Have you been taking your blood pressure medicine the same way every day, believing you're doing everything right? What if I told you that one simple timing mistake could quietly reduce how well your medication works without you ever noticing? I've seen people keep their blood pressure under control for months, only to discover that a small daily habit was making their treatment far less effective. In some cases, that mistake increased their risk during the very hours when heart attacks and strokes are most likely to happen. Today, I'll reveal 5 common timing mistakes that many people over 60 make with blood pressure medication. One of them is so common that millions repeat it every morning without realizing the risk. And if you drink coffee with your pills or sometimes take a missed dose later in the day, you'll want to pay especially close attention. I'm Dr. We focus on practical, research-based health guidance to help you make safer, more informed decisions. Let's begin with a question that could change the way you take your medication forever. Is morning really the best time for everyone? Or could bedtime be the better choice? For years, millions of people have been told the same thing. Take your blood pressure medicine every morning. It's simple, easy to remember, and for many people, it works well. But here's what most patients are never told. Morning isn't always the best time. Your blood pressure follows a natural 24-hour rhythm. While you're asleep, it usually drops. Then, just before you wake up, it begins to rise rapidly. Doctors call this the morning blood pressure surge, and it's one of the reasons heart attacks and strokes occur more often during the early morning hours. Some research suggests that certain blood pressure medications may provide better protection when taken at bedtime because they're working during that critical early morning window. However, this doesn't apply to every medication or every patient. The right timing depends on the specific medicine you're taking, your blood pressure pattern, and your overall health. That's why you should never change the timing of your medication on your own. Instead, ask your doctor a simple but important question. Would taking my medication at bedtime be more appropriate for me? That single conversation could help personalize your treatment and improve your blood pressure control. But timing isn't the only thing that matters. The next mistake involves a common breakfast item that many people consume without a second thought. And for some blood pressure medications, it can change how the drug works inside your body. That everyday item is grapefruit, or more specifically, grapefruit juice. It may seem like a healthy breakfast choice, but if you're taking certain blood pressure medications, it can become a serious problem. Grapefruit contains natural compounds that interfere with an important enzyme in your intestines called CYP3A4. This enzyme helps your body break down many medications. When it's blocked, some drugs stay in your bloodstream much longer than intended, causing their levels to rise. For people taking certain calcium channel blockers, this can increase the risk of dizziness, lightheadedness, fainting, severe drops in blood pressure, or even dangerous heart rhythm problems. What surprises many patients is that the effect doesn't disappear after a few hours. Grapefruit can continue affecting this enzyme for 1 to 3 days after you consume it. The safest approach is simple. If you're prescribed medications such as amlodipine, nifedipine, felodipine, or another calcium channel blocker, ask your doctor or pharmacist whether grapefruit should be avoided with your specific prescription. Never assume that because it's a fruit, it's automatically safe with every medication. And now we come to one of the biggest timing mistakes I see in older adults. It doesn't involve fruit, coffee, or supplements. It's a mistake that often leads to sleepless nights, dangerous falls, and unnecessary trips to the emergency room. And it's completely preventable. That mistake involves diuretics, often called water pills. Medications such as hydrochlorothiazide, furosemide, and chlorthalidone help your body remove excess salt and fluid, making them highly effective for controlling blood pressure. But taking them at the wrong time can create problems that many people don't expect. I've spoken with older patients who believed waking up several times every night to use the bathroom was simply part of getting older. In reality, the timing of their medication was often the real issue. When a water pill is taken late in the afternoon or evening, Its strongest effect usually happens while you're trying to sleep. Instead of getting the rest your heart and body need, you're repeatedly getting out of bed in the dark. For older adults, this isn't just frustrating, it can be dangerous. Standing up too quickly during the night can cause a sudden drop in blood pressure, leading to dizziness, loss of balance, or a serious fall. That's why most doctors recommend taking a once daily diuretic early in the morning whenever possible. If your prescription requires 2 doses a day, the second dose is often scheduled in the early afternoon rather than the evening, but always follow the specific instructions given by your healthcare provider. One small change in timing may help reduce nighttime bathroom trips while allowing your medication to work as intended. But the next mistake is one that millions of people make every single morning without even thinking about it. It involves a cup of coffee, and depending on your medication, that daily routine could be working against your treatment. For many people, the day doesn't officially begin until they've had their first cup of coffee. It's a comforting routine, but if you're taking certain blood pressure medications, the timing of that coffee may deserve a second look. Caffeine is a natural stimulant. It can temporarily raise your heart rate and blood pressure, especially within the first hour after drinking it. At the same time, medications such as metoprolol, atenolol, carvedilol, and propranolol are designed to slow the heart and reduce its workload. When both reach their peak effects together, they may work against each other in some individuals. This doesn't mean everyone taking a beta blocker must stop drinking coffee. For many people, moderate coffee intake is perfectly acceptable. The key is understanding how your own body responds and following the advice of your healthcare provider. If you notice palpitations, a racing heartbeat, dizziness, or unusual blood pressure readings after taking your medication with coffee, mention it to your doctor. In some cases, simply waiting 30 to 60 minutes between taking your medication and drinking coffee may be recommended, depending on your individual situation. A small adjustment like this may seem insignificant, but when repeated every single day, it can make a meaningful difference in how consistently your treatment works. Now let's talk about a mistake that can become far more dangerous than drinking coffee with your medication. It's something many people do after forgetting a dose, and in some cases, it can cause blood pressure to drop much faster than expected. Imagine this. You forget to take your blood pressure medication in the morning. Hours later, you suddenly remember. Many people think, I'll just take 2 pills tonight to make up for the missed dose. It sounds reasonable, but for some medications, it can be a dangerous mistake. Doubling a dose can cause your blood pressure to fall too quickly, increasing the risk of dizziness, fainting, blurred vision, or even a serious fall. For older adults, a single fall can lead to fractures, lengthy hospital stays, and a difficult recovery. Another mistake I see is when people quietly change their prescription without telling their doctor. A medication that's meant to be taken twice a day suddenly becomes once a day because it's easier to remember. Blood pressure readings may appear normal at first, but the medication may no longer provide full protection throughout the day and night. So, what should you do if you miss a dose? In many cases, if you remember later the same day, you may be able to take it. But if it's almost time for your next scheduled dose, it's often safer to skip the missed one and continue with your regular schedule. The correct action depends on the specific medication you're taking, which is why you should always follow the instructions provided with your prescription or contact your doctor or pharmacist if you're unsure. The good news is that most of these mistakes are completely preventable. And before we finish, I want to share 5 simple questions you should ask your doctor. Those questions could help you get the most benefit from your treatment while reducing unnecessary risks. Before your next appointment, write down these 5 questions. They may seem simple, but the answers can help you use your blood pressure medication more safely and effectively. First, ask, is morning or bedtime the best time for me to take this medication? The answer depends on your prescription, your daily routine, and how your blood pressure behaves over a 24-hour period. Second, ask, are there any foods, drinks, supplements, or over-the-counter medicines I should avoid? Even common products can sometimes interact with prescription medications in unexpected ways. Third, ask, what should I do if I accidentally miss a dose? Knowing the correct answer before it happens can help you avoid making a risky decision in the moment. Fourth, ask, do any of my other medications affect how or when I should take my blood pressure medicine? This is especially important if you're taking medications for diabetes, heart disease, cholesterol, or other chronic conditions. Finally, ask, how can I tell if my current treatment is working as it should? Your doctor may recommend home blood pressure monitoring or other ways to track your progress over time. These 5 questions can lead to a more informed conversation with your healthcare provider and help ensure that your treatment plan is tailored to your individual needs. And there's one final message that every person taking blood pressure medication should hear before we end today's video. If there's one message I hope you remember after watching this video, it's this: blood pressure medication can be life-saving, but only when it's taken exactly as prescribed. The right medicine at the right dose and at the right time can make a significant difference in protecting your heart, brain, and kidneys. Never stop your medication, change the timing, or adjust the dose on your own just because you heard something online. Every person is different, and your doctor has access to your complete medical history, which is essential when making treatment decisions. Instead, use today's information as a starting point for a conversation with your healthcare provider. Ask questions. Understand why your medication is prescribed the way it is. The more informed you are, the more confident you'll feel about managing your blood pressure safely. If you found this video helpful, share it with a family member or friend who takes blood pressure medication. A simple conversation could help someone avoid a preventable mistake. And if you enjoy clear, practical, research-based health advice designed especially for adults over 60, make sure to subscribe to Senior Age Wellness and turn on notifications so you don't miss our next video. Thank you for watching. Take good care of yourself, and I'll see you in the next video.